All right, guys, welcome back to Underground Science. In this video, we'll be talking about hemophilia B. Okay, in the last video, we talked about hemophilia A, and it turns out they're both really similar. Okay, so this shouldn't be too long of a video because it's basically the same exact findings. All right, so again, remember our intrinsic pathway, factor 3 activates factor 7. Factor 7 joins in with the common pathway, which is factor 10, right? And then so that's our extrinsic. Our intrinsic pathway starts with factor 12, activates factor 11, who activates factor 9, who joins with its cofactor, factor 8, and that joins into the common pathway and activates factor 10. Then factor 10 eventually activates factor 5. Factor 5 eventually activates a thrombin, right? Converts prothrombin to thrombin. So we have factor 2. And then thrombin eventually converts fibrinogen into fibrin, and then we know what? Factor 2 also stimulates platelet aggregation, okay? And factor 2 activates factor 13, who who then stimulates the cross-linking of fibrin. All right, so that's a really quick rundown of how the coagulation pathway works. Now, we talked about hemophilia A already, which is a deficiency in factor 8. This video is hemophilia B, so just add 1, right? This is a deficiency in factor 9. So again, we can see why it's literally the same exact findings because again, it's a deficiency in a coagulation factor. We said what? That's more deep tissue bleeding. So you see what? Hemarthrosis, same exact thing as we saw in hemophilia A. So bleeding into joints, right? Muscle hematomas, so bleeding into muscles, right? We said we also see things like CNS bleeding, so bleeding into the brain after minor trauma. And speaking of trauma, after bleeding after minor trauma or surgery, right? Those are the main deep tissue bleeding findings we see with coagulation factor deficiencies. All right. So, and remember, this is X-linked recessive, just like hemophilia A. Okay. X-linked recessive. So that's good to know because that involves the genetics of this disease. It's more common in boys, of course, or in males because it's X-linked recessive, right? Males only have one X chromosome. So so let's move on and see what we have, right? So again, we see hemarthrosis bleeding into joints. So you can see limited range of motion, swelling, pain, right, in your joints, and inflammation. You can see bleeding into muscles, right, which could lead to, of course, pain, swelling, and so on, and even mimic DVTs. And then prolonged bleeding after trauma surgery and CNS bleeding, right? So what lab findings would you see? Well, remember, factor 9 is part of your intrinsic pathway. How do we measure that? PTT. So PTT will be elevated. Are there any problems in factors 3 and 7? No, right? So the PT is normal. Are there any problems in your platelets or your platelet count? No. So your bleeding time is normal, right? You just have a deficiency in factor 9. So then the treatment would be give recombinant factor 9, right? So that's it. So you would see mucosal bleeding, you'd see more deep tissue bleeding. And remember, in hemophilia A, we said we would give for the mild form, we would give desmopressin, which would help. Would desmopressin help here? Right? Would desmopressin help here? Well, what does desmopressin do? Increases von Willebrand factor, and von Willebrand factor stabilizes, right? What does it stabilize? Factor 8, right? So that's why we said in the mild form of hemophilia A, where you have a factor A deficiency, in the mild form, desmopressin may help because you may get increased stabilization of factor 8, which can help correct the PTT a little bit. But here, the problem's with factor 9, right? You have a factor 9 deficiency. So stabilizing factor 8 won't do anything, right? You still will have a factor 9 deficiency even if you give desmopressin. So that's why desmopressin won't do anything, right? If we're comparing this to hemophilia A. All right, so you just give recombinant factor 9. Okay, so that's basically it. That's a hemophilia B. Hope this video wasn't too confusing. Hope it's helped a little bit. Thank you guys for watching and see you guys in my future videos.